So welcome everybody. Welcome to our meeting. Let's talk section 1557 and the proposed rule. My name is Ananji Mateo and I am a certified medical interpreter and trainer. And I also run the organization Remote Interpreters of the Americas. We are a baby organization just getting started, just a few of us. And this is our definition is an organization created to support remote interpreters located mainly in the American continent by creating a virtual space where remote interpreters can learn how to advocate for themselves, promote appropriate language access, and raise awareness about the challenges and opportunities of the remote interpreting medium. So today we are going to be talking about section 1557 and the proposed rule once again. But before we do that, I would really like to get to know you. So I'm going to, I'm sorry. And let's also have Kelly, which is going to be co-hosting with me, introduce herself as well. So we can all get to know each other.
Yes, I'm kind of out of place here because I'm an in-person interpreter, but this is a really, really important topic. Naji and I have done a lot of reading about section 1557, so we're really excited to share with you all the stuff that we've learned today. And I work with Naji on InterpreMed, but I'm helping her with this meeting today, co-hosting. So thanks for having me.
Thank you. So I'm going to launch the poll. Here we go. And there are 5 short questions. And the first question is, what is your language pair? What is your location? You can select your location. Are you familiar with these US language access laws? Do you consider yourself to be a language access advocate? And why did you join today's meeting? So I'm going to give everybody a couple of minutes, and then I'm going to share the answers with everybody, and your answers are anonymous, so I don't know who answered what.
Can you put the poll up again? I think I missed a couple.
Yeah, I don't see the poll either, Naji.
Yeah, I just saw about 3 questions.
I didn't see any.
Can you, oh yes.
I'm still answering it.
Oh, I just saw language pair, where you're from, and are you familiar with the different laws? Those are the only things I saw.
I didn't see even that.
Oh, that's strange because, I'm using the advanced poll feature. So sometimes what you can do is let me know in the chat. You can let me know in the chat what your answers are. And then we can go over them together. 4 out of 10 participants participated. 6 out of 10. And I know Jordana and Jody are going to send us their answers in the chat.
I think a couple of people were asking in the chat what the questions were since they can't see them.
Yes, so the question is, so the first question is your language pair. The second is your location. The third, are you familiar with section 1557 of the ACA, Title 6 of the Civil Rights Act, Title 9 of the Education Amendments, Age Discrimination Act, Section 504 of the Rehabilitation Act? If any of those ring a bell, let me know in the chat. If you are unable to answer the poll. Question number 4 is, do you consider yourself to be a language access advocate? And question number 5 is, why did you join today's meeting? Okay, so I think we have 8 answers, and then we have a couple of answers in the chat. So I think I'm going to close the poll unless anybody's still filling it out. No? Okay, so I'm going to close the poll and I'm going to share the results. And let's see. So first in the chat, Jordana says Spanish in person, Washington State, yes to language access advocate, and yes to everything else. Robert is, okay. Jody is an ASL interpreter, that's nice. It's really good to have Jody Price, welcome. ASL English, familiar with all the laws and regulations. And Jody considers herself also an advocate, and she joined, I guess, for the challenges of remote interpreting for deaf patients. Okay. Now I'm going to share the other answers here because I think it's really important to get to know each other. So here we have French. Can you see my screen? Yeah, so we have ASL, French, English, Arabic. Okay, that's good. It's not just all Spanish, so that's great. Most of you are in the United States, and a lot of you are familiar with Title VI and most of the laws. And do you consider to be a language access advocate? Yes, everybody's an advocate. That's awesome. That's good to know. And why did you join today's meeting? I would love to know more about this section because everyone in the language services profession needs to know about these changes. I agree. I need to be on the ball and disseminate info to my colleagues. This is important for me. Awesome. To learn some more about these topics, the impacts, and how this could guide my practice. That's really encouraging to hear. And then I joined today to get more information and to want to know about it. Okay, great. Awesome. Thank you. So yes, we're going to discuss the proposed rules in detail. We have prepared some slides where we compare them side by side. So we are really getting to the nitty-gritty of these laws. Well, section 1557 and the proposed rules. So I'm going to share my screen with you all. And then I'm going to give you a brief introduction as a way to ground ourselves into this meeting to as a statement of intention of what do we actually want to achieve in this meeting, okay? So everybody can see my slides just fine. Okay. So I'm going to read this to you that I prepared for you. In the United States, there has been a long history of discrimination that we still live in today's day and age. Discrimination being the unjust and prejudicial treatment against certain groups of people with subordinated identities. Not so long ago, slavery was abolished in the United States, and it was only 58 years ago that discrimination was prohibited by law in the Civil Rights Act of 1964. Now we are in 2022, and we have become more open and accepting of people with diverse racial and ethnic backgrounds. But there is still a long way to go. So despite the US having robust non-discrimination laws, protected groups are still subject to unequal and unjust treatment. It's enough to look at the data and see how these inequalities materialize in all areas of society. The COVID-19 pandemic exposed and aggravated these long-standing inequalities, especially in healthcare. When we compare, for example, Hispanic Latino patients to non-Hispanic white patients, we observe that Hispanic Latino patients are less likely to have healthcare insurance coverage, experience longer hospital stays, which puts them at a higher risk of having infections and falls, among other health risks. They also face more barriers to accessing COVID-19 testing and vaccination services. They receive worse care than white individuals in different quality measures. And overall report work access and quality of care. And I'm sure this is also going to be very familiar to people with disabilities as well. But do these differences occur by chance, or are there systemic barriers to healthcare that affect patients with limited English proficiency? While it's true that we have Section 1557, which is a law that prohibits the discrimination of patients with LEP, the intent of this law is not really matching the reality of many patients with LEP. And you have probably witnessed that discrimination if you work in healthcare or as a medical interpreter. Think about all the times that you were interpreting and you just knew that a patient was receiving poor treatment just because they were Spanish-speaking Latino, because they were disabled, because they just needed an interpreter. Is this just, unfair? And if it's not, is there anything that we can or should do about it? So today, we want to give you information and show you what you can do to contribute to eliminating healthcare disparities for people with LEP, using your experience and your knowledge. Right now, a good starting point for us, now in September 2022, is Section 1557. Section 1557 of the Affordable Care Act of 2010 is the federal law that prohibits discrimination based on race, color, national origin, sex, age, or disability in all health programs or activities receiving federal funding. Language is also part of your national origin. If a medical center within the definition of the ACA says that they cannot provide me with medical care because I speak Spanish, that medical center will be discriminating against me because I'm not receiving the treatment a patient without limited English proficiency would receive. Therefore, I'm going to have worse health outcomes than them just because of my language. One of the provisions of Section 1557 is providing qualified healthcare interpreters to all patients with LEP at no cost to them. And that's when you, interpreter, come into the picture. You interpret for patients probably every day. You accompany them in crucial moments of their lives. You interact with all of the healthcare staff, many times, from the clerk to the surgeon. You have a multilingual and multicultural view and experiences that maybe some of the people you work with you do not have. You have an understanding of what will be good language access practices. You have so much knowledge because you are at the front line. And at this time, the US Department of Health and Human Services, the HHS, is proposing regulation for Section 1557 of the ACA to enforce this law better. This proposal could improve language access for patients with LEP and eliminate healthcare inequalities and discrimination. Part of this rulemaking process is having a public commenting period for people like you and me to participate in the process. All of us here, we can submit our comments to the HHS, and they have the legal responsibility to consider our comments before they finalize the rule. You can use your expertise to submit an online comment to the HHS on any aspect of the proposed rule, whether it's in terms of sex, gender, disability, any aspect of the rule. This is a good opportunity for you to have a government agency really consider what you think language access and non-discrimination regulations should be like. So to submit a substantial comment, it's logical that you actually read the proposed rule. And to do so, it's important to have some background information that will make it easier for you to read it and submit an informed comment based on your own analysis. So now Kelly's going to give us some background information.
Yeah, sure. Would you be able to pull up my slides for me, just so we don't have to go back and forth sharing our screens between the two of us?
Yes.
Beautiful. Yeah, so we went ahead and made some pretty slides for you today. So we're going to talk about Section 1557 and why it matters in a language access context. However, I will do my very, very best to also speak on my understanding of these changes, of these proposed changes as they apply to disability rights as well. I will say that Nanji and I both read the notice of proposed rulemaking, which was like 97-page document, and did a whole bunch of research and a lot of back and forth. So outside of the context of language access, specifically for folks with limited English proficiency, it was really, really difficult to expand that scope and also cover to the same extent disability rights as well. But again, because knowing that we have ASL interpreters here, we want to make absolutely 100% sure to try and be as inclusive as possible. So I will try and comment on those parts of the regulations as I've seen them as well.
Can I make one quick comment that may be helpful?
Sure.
I so appreciate your reference to that. So many of us who work in with deaf and hard of hearing people, and Tara, who's on here as well, most of the deaf people we work with do not identify as having disabilities. So the juxtaposition is that if a Mandarin speaking patient goes into the hospital and needs an interpreter, or if a deaf patient goes in and needs the interpreter, they need this exact same service because it's a linguistic and cultural minority. So while you're completely accurate in terms of disability laws looking a little different in Title VI as opposed to, but for us in this framework, since these seem to be seasoned people here, I think it's helpful to think of the deaf population in that community in the same vein would any of your patients and families.
Okay, yeah, because they do have some accommodations in here as well for folks who are blind or have low vision as well. So some of those things may come up as well. So I'll do my very, very best to make the distinction. I understand it's kind of difficult because the way the law, like what you said, the way the law talks about it, the Americans with Disabilities Act, and then versus the way communities talk about themselves, like, do Spanish-speaking folks refer to themselves as people with limited English proficiency? No, they're like, I speak Spanish. So I completely understand your point, and feel free to correct me at any point. Totally open to being corrected. Just want to put that out there. All right. So Nanji, you can actually go ahead to the next slide. So we have some acronyms, but considering the fact that we have a lot of folks here who are familiar with these laws, we have a couple of acronyms here. The first acronym that I actually already mentioned is the NPRM, which is a notice of proposed rulemaking, which is basically, they have a notice. They are telling us, hey, we want to make some changes. So we want to make some changes to this rule. So we're going to publish this document telling you about how we want to change these rules. So that's what the notice of proposed rulemaking is, the NPRM. So you might hear me say NPRM. This is something that I've come to recognize working as a medical interpreter, that a lot of us United Statesians, as I like to call us, we are addicted to acronyms. And this is evident in the law as well. A lot of these acronyms are used heavily throughout. So we have HHS, which is the US Department of Health and Human Services. Then we have the OCR, which is the Office of Civil Rights. Now, in this context, this is the Department of Health and Human Services Office of Civil Rights. However, there are different offices of civil rights for different entities. So in the context of this law, we're talking about the Department of Health and Human Services, OCR. So the Department of Health and Human Services is in charge of basically enforcing this law, specifically the OCR. And then we have LEP, which stands for Limited English Proficient or Limited English Proficiency. I did just want to say that I generally don't like to refer to people with limited English proficiency as LEPs, which is often something that you see happen a lot. In the official law, they say LEP person, which is a little bit better than just saying LEPs. But I prefer to say people with LEP or people with limited English proficiency, though I often just, if I'm referring to the group that I interpret for, which are Spanish speakers, I'll just say Spanish speakers. So, and language is super important. So I just want to re-emphasize that, reiterate that. And yeah, just want to open your mind up to that point of view. So Nachi, you can go on ahead. Okay, so it seems like we all know about Title VI of the Civil Rights Act of 1964, but when, oh my goodness gracious, we're on Obama already. Okay. So Title VI of the Civil Rights Act of 1964, it really was it was the first major piece of civil rights legislation that established the protected groups or the protected classes. And the first three protected classes were race, color, and national origin. Now, further pieces of legislation, including pieces of legislation that Nanji mentioned in the poll, actually expand upon these protected classes or these protected groups. So there's sex, age, disability. A lot of these got added as time went on, but this is really the backbone of a lot of the legislation we're going to be talking about today. And just so we are all aware, national origin actually includes someone's ability or inability to speak and understand English, because some people understand English but don't speak it, right? Or vice versa. So, well, not really vice versa, right? So basically any activity receiving federal funding cannot discriminate against these protected groups. So this includes race, color, national origin, sex. The definition of sex has actually been expanded upon in the Section 1557 Notice of Proposed Rulemaking as a result of pending litigation. And then we also have age. Pregnancy is included in sex now. Disability. So disability is, again, the legal definition, but disability would also include such things under the definition of the law as if you are unable to, if you have low vision, if you're blind, if you're deaf, if you're hard of hearing, and that can be deaf with a capital D, lowercase d. Religion, as you said, Marwa, is actually included in Title VI, but it was only in a specific context of, I believe, employment. So you can have a protected class that's protected in certain ways, but not always. Like housing is one of those ones that's only certain classes are protected under housing. Nanji, you can go on ahead. So Section 1557, I couldn't talk about it without putting a picture of Obama up, because a lot of people call the ACA, or the Affordable Care Act, which is the law that contains Section 1557. A lot of people, I even still hear it sometimes, people calling it Obamacare. Kind of the legacy, one of the major legacies of Obama's presidency is this Affordable Care Act. So the Affordable Care Act was passed. It was designed to decrease healthcare costs, increase the availability of healthcare, of health insurance, things like that. Of course, if you're based in the United States, which it sounds like a lot of us are, we know that the ACA has been kind of systemically changed and in some ways eroded over time. So it's not quite the same thing it was at the very beginning. But regardless, Section 1557 is the non-discrimination provision of the Affordable Care Act, which was passed in 2010. So Section 1557 is to the ACA as Title VI is to the Civil Rights Act of 1964. It has to deal specifically with non-discrimination. It goes into healthcare rights in terms of the protected groups and the protected classes. So it builds upon a lot of the stuff that Title VI and a lot of the regulations that kind of built on Title VI that expanded those protected classes. Those protected classes are mentioned, most of them are mentioned in Section 1557, and how you cannot discriminate against people in the provision of healthcare. And this has to deal with covered entities. So covered entities are the healthcare entities that must follow Section 1557. And that is also something that's changing a little bit with the proposed rule revisions that they propose in the NPRM. So basically in healthcare, civil rights in healthcare, that's what Section 1557 of the Affordable Care Act touches on specifically. And we're going to go on to the next slide. So Section 1557, I actually had the pleasure of looking at Mara Yodelman's presentation on Section 1557 that was given a couple of weeks ago. And I was in envy of her timeline because it's way more complex than mine. But this is like the greatest hits, the biggest hits in terms of where we have these final rules with Section 1557. So the Affordable Care Act came out in 2010, but then in 2016, we had our, at the time, it was the final rule. But now as we have more final rules, obviously it's not the final rule. So we have the 2016 final rule that came out under the Obama administration. So just like we're doing now, they had a notice of proposed rulemaking, people could comment on it, and then they had, I believe, a 60-day comment period. And then after the comment period, they take those comments into consideration. They make the changes based on their proposed changes and the comments, and then they release the final rule. And then the final rule gets put into place based on a particular timeline. So that happened in 2016 under the Obama administration still. Then in 2020, we had another final rule come out. There was a comment period open. I actually didn't hear about the comment period, which was surprising. I'm not sure if that's a reflection of my life or if that's just a reflection of, I'm not sure if it wasn't very well publicized. But in 2020, we had the final rule come out again after a comment period of 60 days. And it changed a bunch of things from the 2016 final rule. And now where we're at is we don't have a final rule yet. That is what they're trying to get comments on. And they released this document, the NPRM, the Notice of Proposed Rulemaking, that tells us these are the things we're planning on changing. We want to get some feedback in terms of how to change these things in terms of the particulars. So get back to us on that. So that's where we're at right now with the proposed changes, 2022 with the NPRM. The comment period ends on October 3rd, and this was put out by the Biden administration. And I did just want to mention very briefly in terms of who kind of is the head of the Department of Health and Human Services, because this was actually, we've had a lot of like back and forth talks about this. And I think it's important to kind of contextualize this, that each administration appoints its own head of the Department of Health and Human Services. So that's why we often see a lot of the changes kind of line up with the priorities of the different administrations. It's just the nature of a change in administration. You're going to have a change in the head of the Department of Health and Human Services. So we can go to the next slide now. This is a big one. So it was really, really hard to get all this stuff as concise as humanly possible onto a slide with tables. But basically, these are kind of, I'm going to go line by line here as much as I can, talking about how things changed from the 2016 rule to the 2020 rule, specifically as it relates to rights for folks with limited English proficiency. However, some of the changes in some ways do affect language access, access to interpretation services and those auxiliary aids that include qualified interpreters for the deaf and hard of hearing, as well as additional auxiliary aids, for instance, for folks who are blind or have low vision. So some of those things did change as well. But in terms of specifically spoken language access, the first thing that we have is the tagline requirements. So the tagline requirements, basically entities, covered entities that were required to follow Section 1557. In the 2016 rule, they had to provide these, what were called taglines. That was the word that they called them, in the top 15 languages, either in their state or in the states in which that entity operated, notifying folks with limited English proficiency about the availability of language assistance services. However, this changed in the 2020 rule. In the 2020 rule, the covered entities didn't really have a requirement to put those in any languages other than English. However, given that they had already invested the resources into creating those taglines, you oftentimes still see the taglines in the top 15 languages still when you see the taglines being provided to this day, because it just doesn't make sense to revise them if you've already invested the resources to create them, right? So that's a change that was made in the 2020 final rule. And then significant documents should have those taglines. So those taglines had to be in a prominent place at a physical location. They had to be in a prominent place, I believe on the website as well. And they also had to be included with, quote, significant documents. So they gave some kind of general guidelines for what significant documents were. I don't believe those were removed in the 2020 rule, that significant documents requirement, but there were a lot of things that were included in the 2016 rule that weren't necessarily repeated in the 2020 rule. So you would have to go back to the 2016 rule to still see some of those requirements. The 2016 final rule, now this does apply to both spoken language and sign language interpretation. So in the 2016 rule, they prioritized the use of high quality VRI services. So another acronym, VRI stands for Video Remote Interpretation Services. So that high quality was really prioritized for regardless of the type of interpretation that was being provided. However, in the 2020 final rule, the high quality provision really only clearly remained for sign language interpretation. And that's pretty much the gist of the change with that. With the 2016 final rule, it required the use of qualified interpreters and translators, and there was a section with definitions of these terms. The 2020 final rule still required the use of qualified interpreters and translators, but removed that definitions section. So if you wanted to see those definitions, you would have to go back to the 2016 rulemaking. And in addition, there's actually a separate set of requirements for qualified interpreters for folks with limited English proficiency versus folks who would be in need of a qualified interpreter for someone who is deaf or hard of hearing. And these next two do apply both to spoken language and sign language interpretation. The prohibition of the use of accompanying adults as interpreters, unless one specifically requested by the person with limited English proficiency. This requirement, though, isn't as clear with sign language interpretation. There was basically they mention it, but it's just not as clear. But again, these things do change a little bit, and there are actually there's more specificity, which we'll be seeing here shortly. Except in the case of emergency. So of course, in the case of emergency, you can use an accompanying adult as an interpreter. Now, in terms of the use of minors as interpreters, this is across the board prohibited, and except in case of emergency in a sort of temporary and transient way. But these things remained unchanged in the 2020 final rule. And I think Nanji wanted to go ahead and say something on this, so I'll let Nanji go ahead and speak.
No, I just wanted to comment for the recording for people who are going to watch this, who may have, maybe wondering about the removal of the word qualified. It's really important to be really specific with the wording that we add to these rules. This may be very obvious for people who maybe are in the United States, but outside of the United States, sometimes we don't understand why it is so important to have the exact word when it already says no discrimination. It's because one word can be reinterpreted in different ways depending on the covered entity and their intentions. So that word qualified, it's really important to include it. So that I was just wanted to add that for the recording for people who may be wondering.
You actually brought up something really important, because I realized I just kind of glossed over the fact that in the 2020 rule, they actually did remove the word qualified a couple of times. They claimed that they were redundant instances, and that's a quote from the 2019 notice of proposed rulemaking. So that term qualified, it was still there, it just wasn't there as many times in the 2020 final rule. So thanks for bringing that up, Najee, because you reminded me. Now, in terms of language access plans, so this applies to spoken language and sign language as well, having a language access plan in terms of your policies and procedures and how you're planning on providing interpretation and translation services. Of course, translation wouldn't necessarily apply across the board. But so the 2016 final rule didn't require a language access plan, but it highly encouraged it. But in the 2020 final rule, that was removed. And then in the 2016 final rule, and this only applies to limited English proficient patients, not to deaf and hard of hearing patients who might utilize the services of a sign language interpreter or any of the other like oral transliterators and things like that. In terms of determining to what extent a covered entity needs to provide language assistance. In the 2016 rule, they said that it needed to be evaluated on an individual by individual basis when it came to the individuals with limited English proficiency. However, in the 2020 final rule, they reverted back to this, this tool called the 4-factor analysis. So, Nanji, would it be okay if you showed the slide with the 4-factor test, so I can just very briefly explain what the 4-factor test or the 4-factor analysis is? Thank you. So the 4-factor analysis is actually from a guidance document that came from the year 2000. It was actually during the Clinton administration, from Executive Order 13166. So basically, a covered entity, in order to determine to what extent they need to provide language assistance to folks with limited English proficiency, they had to weigh these 4 factors. They kind of had to balance them. So demographics, okay, what percentage of people in the area where your clinic is have limited English proficiency? So if it's a lot of people, that weighs heavily. Your frequency of contact with that population. If it's high, that's going to weigh heavily. If it's not, it's going to weigh on the other end of the scale. Nature, basically, what type of services are you providing? Are they really, really essential to people's health, or are they not? If they're really essential to people's health, then it's really going to weigh heavily in favor of providing more language assistance. And then availability and cost was another factor. If something was too cost prohibitive, too expensive, if the availability of, let's say, a Kakchikel interpreter is very, very limited, then that's also going to weigh heavily against providing language assistance services to that particular group, because it's just too cost prohibitive. So you have to weigh all these different factors in determining to what extent you must provide language assistance. And this was reinstated in the 2020 rule versus, so it really judged people with limited English proficiency as in terms of what extent of language assistance they were entitled to at each covered entity based on them as a monolithic group versus on an individual by individual basis. So I actually think now, since we've discussed the 2016 versus 2020 changes, I don't know, Nanji, what do you think? Where do you think we should go next?
Yes, what we would like to do now is create breakout rooms. I'm going to send you a link with the table of the 2016 final rule and the 2020 rule, and also the 4-factor analysis. So you can compare and comment what do you think about the differences and changes applied in 2020 from those in 2016. So while I'm doing that, Kelly, would you create the breakout rooms while I am getting the documents?
Sure. How many people do you think we should have in breakout rooms?
So we are 15, we're actually 13, right?
This is true. I would say maybe like 3 people per breakout room, right?
3 people per breakout room, that would be nice, yeah.
Okay, all righty, well, let me go ahead and get those breakout rooms started. 1, 2, 3. We're not going to have the co-host. Or
Yeah.
should we put ourselves in the breakout rooms too? What do you think?
Yeah, that would be good. Yep, let's do that.
Okay, all right, well, I'm creating breakout rooms. We're gonna have 4 breakout rooms with about 3-ish people in each.
Before you leave to the breakout rooms, I'm going to send you the link in the chat. So really keep an eye on the chat to compare 2016 and 2022. And
How long do you think we'll be in rooms for?
what about if we do 10, 15 minutes, depending on like the conversation? Let's do 10 minutes. I think that will be okay.
Okay, all right, we'll do 10 minutes then. I can go ahead and open the rooms then.
Okay.
1, 2, 3, go.
Okay, thanks.
Always fun to open the breakout rooms.
Okay. I'm going to pause the recording because I always forget to restart it. So I'm just going to edit this out.
Okay.
So what if you go to room number 1 with Jody?
Okay. Oh, I see Catherine's in room 2, but no one's joined her yet.
Oh, yes. I think they're joining Sebastian and Tara.
I feel so bad. Catherine's all by herself.
Yeah.
Maybe I can move her to maybe another room. Oh, Marwa came back. Maybe I'm going to go ahead and move Catherine to room 3. Oh, wait, no.
Yes.
Catherine to room 3.
Catherine is room 2.
I just moved her to room 3. So that way
Okay.
we could kind of like, there we go. Now she's not alone in a room by herself. Okay.
Okay.
I'll go to room 1 and then
I'll go to room 4 and I'll
okay,
go
and
up.
we'll meet in the middle.
Okay.
2. Oh wait, you can still see the chat. Do you see it?
Yeah. Okay. So it's here. Oh, if I open this document, I won't be able to see you.
Yeah, sorry, bear with me. I'm on my phone as well. I wasn't
Over.
expecting.
That's okay. We can just all be camera off and
Hi, I saw that you asked for help. Do you have the document with you?
No, that's actually what I was gonna ask if you could share it in the chat again.
Yes, I just sent it in the chat.
Okay, thank you.
Okay, you're welcome. So you're encouraged to discuss some of the differences between the final rule and the 2020 rule. What you think was okay, what was not okay, what was appropriate or inappropriate for them to do. You can go to, row by row. For example, in the first one, cover entities must post taglines in the top 15 languages, notifying people with LEP of the availability of language assistance services. Have you ever seen those taglines, what they look like? Do you know?
Yes, they're like 1 or 2 sentences and it's in the language, like for example, in Spanish, it'll say, I speak Spanish, and it'll be like 2 sentences in that
Yeah.
language. Yeah.
Yeah, that's what they call the tagline. So the 2016 final rule said that you should have the taglines in all significant documents. Whereas the 2020 rule says that the entities, they have to notify about language assistance services, but the table tells us that there was no requirement for this to be in the non-English language. So it's like saying nothing. It's like saying, if you speak Spanish, please go to this link in English, then the person wouldn't obviously understand. So what do you think about that?
Right. Yeah, I agree with you. It's kind of it defeats the purpose to put something in English and saying, oh, if you need help in Spanish, let us know, but it's in English, so you're not going to understand it. So that already serves as a barrier.
Yes, it creates a barrier. It doesn't breach any barriers. So that's 2016. What do you, Dawn, Amur Turagaba, what do you think?
I think it's important for people to be able to understand, because if you're not fluent in English, and some people may not even be able to read English. I mean,
Yes.
so telling them that you know, there's something available in a different language, they may not understand it, you know, they may not even be able to read it. So it's important, I think, to have it in the different languages, because I think, yeah, it was this week I had, I guess it was not really a tagline, but somebody who didn't understand, obviously, English, was asking what the sign that they had posted was, that they had only posted it in English, but they have, you know, it's for consult. It's where they bring the people to do the vitals. So, you know, if you don't, if you speak a different language, what are you supposed to do? I mean, it's good to be able to understand what is posted, right? So yeah, so I think so it is important, absolutely.
Yeah, it feels like it feels like the entities that do not think through these things, they just want to check mark, yes, language access, yes, okay, and then don't really think through about it. What's the most meaningful way of providing this language access? So that's shape a change in, I think, in perspective between 2016 and 2020. And let's see, significant documents should have taglines accompanying them. What do you think about that statement? Significant documents should have taglines accompanying them. I'm going to give you my thoughts, and then I'm going to go to the next breakout room, okay? I think when you say significant documents, do we know what's significant and what's not significant? Because the law needs to be very clear on what's considered significant. And this could read as something ambiguous, right? If you were a cover entity, which documents do I need to put taglines on? So, you know, oh, sorry.
Oh, no, no. Yeah, I was going to say that. Yeah, it's really arbitrary. It just leaves too much room for each entity to interpret, okay, what we consider significant and what we don't. So yeah, like you said, it just leaves too much room for not including taglines.
Yeah. And then the 2020 rule doesn't even mention anything about it, apparently. Doesn't even mention the documents they should be on. So there is even more confusion in there. So, you know, I want you to keep going through the table like this, and, you know, bring your professional experience, because I know you are experienced interpreters. So then we go back to the main session and try to discuss this further. Okay.
Thank you, Nanji.
You're
Okay, thank
welcome.
you.
You're welcome.
So what do you guys
Will happen is we have them set up on several floors throughout the hospital. The ER has several of them where they're at, and it's kind of there are so many devices deployed throughout the hospital. But one thing we notice often is when we have a deaf patient go to the floor, they're often the only person who's deaf on the floor, and they're the only person that uses sign language. And then we will go to put the rover in their room, because you know how often providers are in and out of those rooms. And then they'll tell us that they don't know where the iPad is, or that they're using it for other spoken languages. But we also have phones in every room for spoken language. But the providers, the technology is newer, and because you can see face-to-face interpreter on the screen, a lot of the providers like it better. I mean, who wouldn't like it better? But then we don't have access for the deaf patients when we, the live interpreters, leave for the day. So sometimes we come in overnight and no one's communicated with the deaf patient for the entire night, even though they've gone for procedures, because the iPad was just with another language. And the deaf person isn't able to convey that they're not understanding what's going on, or that they need the VRI interpreter. that happens to us all the time. So we have to constantly re-educate the staff of when there's a deaf person on the floor, they have to leave it because their only communication is through video, not sound. I wonder if that is something that maybe has impacted it as well. But everybody deserves high quality. It doesn't matter what language they speak. Everybody should have access.
Right.
But
And you would,
we
you
have
would think
phones,
that
so I don't know.
you would think that the hospitals, with all of, the money and funding that they have flowing through them, would be able to afford maybe a couple extra devices per floor. But we see again and again that patients who are not necessarily fitting into the mainstream of other patients are kind of deprioritized. And I think it's a really bad policy in terms of equal access too, because they're not taking into consideration that there are patients from different countries who are also deaf and hard of hearing. And maybe, they might speak, a foreign sign language, or they might not, they might be lip reading. But on top of that, they're not taking into consideration the smaller details of what kind of patient they are and what kind of care they're seeking. I'm in Buffalo at International Institute of Buffalo, and we work with all the hospitals locally. And one big one that has never successfully been able to transition to remote interpreting fully is the one that has inpatient mental health facilities, because a lot of patients seeking that kind of care, either voluntarily or involuntarily, like, they're not going to talk to a phone. They're going to look at that and be like, that's the experience that we've had. Like, they will not talk to the phone, and they might talk to a video screen. They might,
Right.
but they're not going to talk to the interpreter
That's
at
so
all.
true. Especially if they're like having symptoms of hearing voices or something, and then there's something just coming from a device that they already may or may not trust. Yeah, that's such a good point. We use the iPads, or I actually use the iPads with, I do a lot of mental health interpreting for deaf folks in inpatient, but I often will use the iPad with me as a team. I don't know, I'm sure it is, but I don't actually know. Do you guys, do you work in teams as spoken language interpreters too?
My parents lived on Delwood Road, right
Oh,
near
I know.
Hillaire Circle. I had friends on Hillaire.
Mr. Panis, milkmaid. It was so.
Yes. Well, yes. Oh my gosh.
That's hilarious.
What a small world.
Very. Sorry, Chris.
It's all right. I'm far away from everybody. Every time I join one of these, they're like, Arkansas. I was like, yeah,
Well,
I lie.
My favorite grand aunt was from Texarkana.
I only go to Texarkana when I'm going to Dallas, like just passing. I'm in northeast Arkansas.
Okay.
So it's closer to Memphis, Tennessee.
Oh, wow. Okay.
Yeah. It's in a little weird part where I'm close to Missouri, Mississippi, and Tennessee.
Right. And do you work in all those areas, or do you work primarily?
I'm actually, I am an interpreter, but I haven't worked as an interpreter in a long time. I work mainly in education, educational interpreting, in Spanish. And now I'm working with language advocacy with an organization called NATISL for educational interpreters and translators. And so I do mostly video producing for them.
Great. No wonder you have a great sound.
Yeah, oh, thank you. It's a work in progress, but I am proud of it. And but yeah, that's what I'm doing right now mainly. And so I've connected with Kelly and with Nanji through Americans Against Language Barriers, where they teach training courses. And so I quit my job in June. I was working full time in school, not interpreting. I quit my job because I was ready to do just something more involved with language advocacy. I didn't know if it was interpreting. I didn't know what it was. And then it kind of just, everything fell into place. And here I am. I'm always looking for ways to connect and get more involved. Medical interpreting is still not off the table. It's literally just whatever comes. I just want to be more involved.
5 seconds, Jordana, what do you do?
Right, these laws must apply to education too, because I work in both education and medical. Yeah, I would think.
Yeah, the same laws apply. So that's another reason why I wanted to get more information, because the same law would apply for federal programs in schools. Yeah.
Yeah.
Hi,
Nice to
milkmaid
meet you
friend.
guys.
Nice to meet you too.
Nice to meet you.
See you, Jody.
Hello, everybody. Welcome back to the main room. I could hear some interesting conversations, and let's just wait for the rest of the attendees come back to the main room. I think some of them are still in about 32 seconds or so. I want to share what I heard, because I thought I was just for a couple of minutes there, and I thought it was just so interesting, though that small amount of time I was there for. So let's just wait for the others to come back.
I think we've got like 2 seconds and everyone should be coming back about now. Everyone coming back in.
4, 3, 2, 1. Okay, everybody's back. Okay, so welcome back to the main session, everybody. I heard your conversations were super interesting, and I also like the conversation that Robert and Jesse, I'm sorry if I'm mispronouncing your names, about the number of iPad devices for deaf patients available in the floor. And I think considering that the proposed rule now considers telehealth provisions for non-discrimination, I think it really ties in really well that issue with the iPads. And also, I really liked there was another room where they were meeting each other like, oh, you're from this place, and it turns out they're like in the same city. I'm not sure in the same town, but that was fantastic. And we got to yeah, I think that was amazing that you are also passionate about language access and are here. So what about you, Kelly? What do you hear?
So I spent a lot of time in room 1, and it was really interesting because we were talking about, well, more like I was listening a lot to what was being talked about how basically the gist is, it's great that we have all these rules, but what's the purpose of these rules if there isn't going to be any enforcement? And if it seems like the people whose rights these requirements are intended to protect, those people have to keep on basically reasserting these things. And they have to be an expert in these things in order to reassert that these things have to be provided to them. And then it becomes a matter of basically like learned helplessness. Like, okay, well, what's the point of having these things if I have to constantly be reiterating them?
And have the language to talk about it.
Exactly.
We're talking about people whose first or preferred language is not English, whether you're deaf or another language. And now we're asking them to advocate in a language that they don't understand well.
Yes. Yes. Yeah. A lot of frustration, and understandably so. So that was, and we also did a lot of there was a lot of comparisons between spoken language and sign language, which I always really like hearing that and seeing that, because I think it's important for us to realize that we're all in this together. So yeah, and I think Robert has his hand raised, so I suppose we'll give the floor to Robert.
Okay.
I just on that note about like having to advocate for yourself in another language, also is a lot of times when there's, rules aren't being followed in these cases, we let people know like, oh, they like let the patient know that they can file a civil rights complaint about this. This is bad. They should file a complaint. And I think a lot of people are afraid to do that because they almost see it as like biting the hand that feeds. Because they're just like, well, I got into this country and I'm like so thankful to be here. And it's been, I'm afraid that if I do this, there's going to be some kind of retaliation, or I'm going to get, deported or they're gonna come after me. So it's double-edged sword.
Mhm. I think that's a very interesting comment. And as I read the proposed rule, I think, how can we incorporate those things into the rule so they're more visible? So let's continue with the next part of the presentation. I'm going to share the screen, and now we're going to move on to the 2022 rule, right, Kelly?
I will unmute myself. Yes, we're going to move on to the 2022 proposed changes. And I think you can go to the next slide, actually. There we go. It'll let you. Yes. So once again, Kelly had to expand her already big table into an even bigger table. So I do apologize that I couldn't make it any less wordy. But basically, so we're sticking with the existing categories of the existing stipulations that were in the 2016 and 2020 final rules, and how they kind of contrast with the 2022 final rules notice of proposed rulemaking. So first we have the taglines requirement, which was removed in the 2020 rule. However, the 2022 rule, they actually renamed the taglines. They're like, we don't want to call them taglines anymore. And the full name of them, although they are often referred to in the NPRM as the notice of availability. It is the notice of availability of language assistance services and auxiliary aids and services. So this is now, they do not call it the taglines for language access. They call it the notice of availability for language assistance services. So that applies to folks with limited English proficiency, and auxiliary aids and services. So this wouldn't just be for the deaf and hard of hearing. This would also be for folks who are blind, have low vision, need other auxiliary aids. So an example, just for those of you who are not familiar with the kind of verbiage of the ADA, the ADA classifies auxiliary aids and services as those things that make communication with someone who has what they consider to be a disability as effective as communication with someone who does not have one of those disabilities, as outlined by the ADA, and then later by, oh my goodness, it was that other act where they basically expanded upon the definition of disability. So now disability includes a lot of things that it didn't include before. So this applies to both. It doesn't just apply to spoken language. And these notices have to be posted in a conspicuous location on the entity's website and in their physical location or locations. There is now an additional option offered for this notice to be in an audio format, which I thought was really cool. I'm kind of considering how can clinics and hospitals implement this, because not only is this applicable to the deaf and hard of hearing community, the blind and low vision communities, it is also applicable to communities that might not be able to read or write, for instance, which is a community I often interact with as an interpreter. Now, instead of these quote unquote taglines having to accompany those significant documents, they actually give clear examples and specific examples of written communications and electronic communications in which the notice of availability should be included. So this includes things like discharge papers. There's a whole list. They give you a really long list, which is a little bit different than those significant documents requirements, because this is actually something that I mentioned in the breakout room, in breakout room 1, is that when it came from the change from the 2016 rule to the 2020 rule, it was really difficult to find a lot of the original text of section 1557, of the definitions, provisions, and things like that. So it became difficult to find those significant documents to even refer back to, and it was just a general list of categories of examples. Non-inclusive lists, not an all-exhaustive list. And then these notices, they're now required to be provided on an annual basis and upon request. However, in response to the potential, they were expecting some kind of pushback on that as a result of costs. This is mentioned clearly in the notice of proposed rulemaking by the Department of Health and Human Services. They're saying that people can opt out of receiving these notices, the notice of availability, but that by opting out of the notice of availability, this does not mean that they're declining language assistance or the need or the use of those auxiliary services and aids. So that's just the taglines. That's just the taglines. This, I'm telling y'all, this was super, super extensive, and we really did read through the whole thing and did a whole bunch of research on this. So next up, we have the requirements for video remote interpretation, like the bandwidth requirements, things like that, high quality video, high quality audio. So this was prioritized just for sign language in the 2020 final rule. However, the requirements for spoken language interpretation were actually reinstated. So now it looks more like the 2016 final rule. But there are some very specific things with this. Because, and we'll talk about this in a moment, there are now specific requirements for telehealth. So there's a really big part of this that deals with telehealth. Now, in terms of qualified interpreters and translators, remember those definitions were removed in the 2020 final rule, and some of those instances of qualified were removed from the 2020 final rule. In the 2022 final rules, NPRM, similar to the 2016 requirements, a little bit more specific. I put allegedly because it's very difficult to find the 2016 version to compare with the 2022 version, like really side by side, nitpicking it apart. Because the other thing too is these are proposed rules. So we don't even know if this is going to be the final text of the final rule of 2022, which might even be the 2023 rule at this point. Now, like I said, there's a big section on telehealth, talking about increasing telehealth equity. There are specific non-discrimination provisions in telehealth for people with limited English proficiency, as well as people, and this is again, according to the law, the definition of people with disabilities, people who would need auxiliary aids, or people that in some way, shape, or form have some sort of condition or factor that would result in them not being able to engage with these telehealth services in the same way as someone who might not have those disabilities, impairments, or different sensory modalities of interacting with things. The language is very, 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 they mention a whole bunch of different examples there. We still have those prohibited use of accompanying adults as interpreters, except in cases of emergency or specifically requested and accepted, and the minors as interpreters. However, there are specific examples of cases of emergency for when it may be acceptable to use an accompanying adult as an interpreter, but they mention that it's in a very temporary way, in a transitory way. It's not meant to be a replacement for a qualified interpreter. It's only until a qualified interpreter is able to be obtained.
I have a question or a comment that, and maybe this goes into comments that we send in, but what I've always felt was helpful is to document so-and-so facilitated communication rather than interpreted, because I think that distinction is both a liability issue. So we think of an interpreter as we're trying to encourage this trained, qualified professional interpreter. So not even to use that word, but somebody who's not trained would be helping to facilitate. So it's just sort of a
like that
caveat that I think has been helpful. We actually put it into the, we're working on putting it into the medical record that way.
And it coordinates nice with Spanish too, because we have the same verb.
Right.
Yeah, Nanji.
I wanted to mention something about machine translation because because the machine translation must be reviewed by a qualified human translator, but it's only for critical documents. So it's not for example, things like flyers or like marketing documents. It's more for vital documents. And that's one of the exceptions where it can be machine translation without human proofreading, which of course I don't agree with that, but I wanted to mention that too.
Thank you for mentioning that, because one, Kelly skipped over it, and two, Kelly didn't put it in the big, complicated huge table, so I apologize for that. And the thing though about what you had mentioned, Jody, documenting the use of an accompanying adult, of a companion, because in the context of the use of an ad hoc interpreter for someone who's deaf or hard of hearing, they often refer to these folks as companions, a companion interpreter. This actually specifically says that you need to document it. Not only do you need to document the request by the person who's requesting the use of a companion as an interpreter, but you also need to document the agreement of it, which is a change here. So this is very explicit compared to the 2016 rule. And then the providers in this case, and this is actually something that we kind of jumped ahead to this and when we were in breakout room 1, but how in the 2022 rule, it's still left up to, and this is explicitly stated that it's still left up to the covered entity. So the healthcare facility or the provider in that particular encounter to determine if the companion's language proficiency, their bias, whether they're helping understanding of the person with limited English proficiency or the person who is in need of interpretation services, that is up to the covered entity to determine if that person is able to meet with that need. So that was something that is mentioned in the 2022 rule. Language access plan. So I want to point something out here that there's a language access plan, which is something that kind of talks about ideals. It talks about general framework for how we are going to provide assistance. However, this was not included in the 2022 final rule, not to the extent of a language access plan is required. However, what is required are written language access procedures. So when I say, perhaps it would be best to use Jody's word, written communication procedures, how we are going to utilize interpretation services and accessing those other auxiliary aids. So for example, a clinic or a covered entity or a hospital has to actually have written procedures and policies for, if an employee wants to schedule an interpreter for a particular patient, they should be able to look at these policies and say, oh, this is how you schedule an interpreter. These are our policies for scheduling an interpreter, specific procedural steps versus a language access plan, which is a very generalized thing. So no, they don't require a language access plan, but they do require written out procedural language access procedures is what they call them. And then the last thing that we mentioned here, I had mentioned the 4-factor analysis. So the 4-factor analysis is effectively once again taken out because it was put back in the 2020 final rule. It had been taken out in the 2016 final rule because we were trying to shift that evaluating to what degree we need to provide language assistance. That was shifted back to each individual person with limited English proficiency. But now it's swinging back around the other way. And now we're swinging it back over to each individual person with limited English proficiencies need. Whereas for the deaf and hard of hearing communities and any other auxiliary aids you might need, that's based on the effective communication standard. This is based on individual need now for each person with limited English proficiency. So it returns to the similar requirements of the 2016 final rule, but it admits that reasonable steps do have to be taken to provide language access, not necessarily to each person with limited English proficiency, but on a person by person, case by case basis. And then this was something really noteworthy I found that was said in here regarding this. As the availability of telephonic interpreters increases, the evaluation of the reasonableness of providing language services shifts. So we have an indication here from the Department of Health and Human Services. They're saying that it's more reasonable than ever to provide language access because of how available it is. Robert, I know that was a lot.
I like that this is going back I mean, obviously everybody, like I said, it's going back to this way, but I think it's important too, because if you live in a place where let's say if they're going by, oh, well, what are the top 10 languages in our state? If you live in a place where top 10 languages of your state don't match the top 10 languages of your region, then there's plenty of language access services available for languages X, Y, and Z, where those populations are either like teeny tiny in your area to non-existent, as opposed to, you know, these languages A, B, and C, which are not really top 10 statewide, but they're like one of the 3 main languages in your area. Because that happens a lot with New York City versus New York State and Buffalo. It's very different from the top 10 languages in New York City. And a lot of things county-wide or city-wide, we're basing it off of the statewide top 10 languages, and it doesn't really match what the actual top 10 are here.
Yeah, and one more thing that you actually reminded me of that I think would be worth mentioning is that there's not a cutoff. So it's the top languages. I forget exactly how many top languages because there's so many numbers going around in my head right now, but I can tell you definitively that they do not have a cutoff. So for instance, if you're a state like Montana that doesn't have a lot of language, that doesn't have a lot of linguistic diversity, is not, at least not as much as other states. Let's say your top 5 are such and such languages, but numbers 3, 4, and 5 have less than 200 language speakers. There's not an arbitrary cutoff. Like, it doesn't matter if there's 5 speakers of that language, you still have to provide that notice in that language if it's within the top X number. And they did specifically state that no, they're not going to propose a cutoff for that, which I thought was interesting.
That's awesome.
So that's basically the long and short of, at the very least, the changes that we noticed, the biggest takeaways. Of course, there's going to be a lot of chatter about this. But Nanji, I was curious, where do you think we should go from here? Do you think we should go into breakout rooms again to discuss what we think of the 2022 rule?
Well, I think what I'm thinking is that maybe if we have more time at the end, maybe we can go back to this table because there is a lot to unpack here. And we only have like about 30 minutes and we only have a couple of things to cover, like the new things that the 2022 proposed rule is proposing. After that, I'm going to give you some resources for commenting and such. And then if we have time, we can go back to the table, I think. Okay, so let me go to the next one. Okay, this one. So,
do you want to talk about this, or would you like to talk about this?
Well, you're much better at words than me, but these are some of as I was reading the document, I was comparing the things that, because the 2022 proposed rule reinstates a lot of the 2016 rule that the 2020 rule removed. And so I think the most substantial changes are the new things it proposes. And one of those things is requiring relevant staff training. So this part, would you like to talk about it, Kelly?
Yeah, so there's a pretty significant training requirement part of this. So all relevant staff needs to be trained in the new parts of this legislation. Of course, any new incoming staff needs to receive all that training, right? Now, there was actually a quote that I pulled out that I thought was really interesting, and it was talking about how training heavy this really is. Because, let me see here. Of course, I have like 50 documents open right now. But I believe it was about 70% of the costs of the estimated costs for the proposed rulemaking. Actually, 70% of those costs would go towards training. So this is a very, very training heavy piece of legislation, proposed legislation coming up. And then they have that new section 1557 coordinator role, which now there is like a civil rights compliance officer role that already exists, but this is specifically for section 1557. So this is a role specific to section 1557. It can be spread out, I believe, amongst multiple employees within an entity, or it can be the same person who's in charge of who's the civil rights coordinator, has the additional title of the Section 1557 coordinator, but at the very least, it's a dedicated set of responsibilities specific to Section 1557. And there's actually a lot in there about that, a lot.
Yeah.
Yeah, I'll let you go on.
Well, they even define, they don't only define that having a Section 1557 coordinator role, but they also outline the responsibilities of this person. This person would process the grievances and the complaints on language access that are submitted to the cover entity. And one of the new things that these 2022 proposed rules proposes is that instead of having all language access complaints go through the OCR, they are going to have the cover entities can have or should have a separate grievance procedure. So when I read this and the coordinator role, it made me think, me as a remote interpreter who is not in the US, sometimes I don't even know how to file a complaint with the OCR. I need so much specific information that I just don't have. And I think this is good for me because I am able to have one point of contact outside of the OCR, one person I could reach out to file my complaint outside of my supervisor in my agency. If I happen to know somehow the new section, the 1557 coordinator. But at the same time, this can also be a problem because this gives a lot more leeway to cover entities to manage the complaints in the ways that they want, because the Section 1557 coordinator is still an employee of the same cover entity. So there could be a conflict of interest, right? And that could be tricky to navigate. But one thing that I do like that I think kind of counteracts, I'm not sure if it's here, but is that they require all of the complaints that are submitted to a cover entity need to be filed and documented for at least 3 years, include all of that information. And then the HHS is going to, when they do their compliance reviews, is going to go over these tracked documents to be able to see if the cover entity has been appropriately managing all of their complaints. And I think that's really important because now, I'm not sure if it was in the 2016 rule, because we tried to find it and I think it was really hard to find online, not the 2016, sorry, the 2020. I'm not sure if it's there, but it gives the HHS a way to document and identify patterns in a cover entity, patterns of discrimination through that documentation of those complaints. So I could keep talking about it all day, but I think Jody raised her hand.
Yeah, I hate to sound like such a cynic, but I guess I am. So when I was at NYU, there was a Section 504 coordinator who knew absolutely nothing about the ADA as it applied to deaf and hard of hearing people. Absolutely nothing. The general counsel knew nothing, which is one of the reasons they were sued. So I'm wondering how is the training? How is it going to be ensured that people are well trained and in language access and deaf and hard of hearing as Section 1557 point people? Does that make sense? I mean, I just feel like it's going to be arbitrary again.
Yeah, I don't think it's clear at this point, because when we have an NPRM, it's basically saying this is what we want the stuff to say. But at the end of the day, what it ends up coming out and actually saying is going to take into account all of the comments, going to take into account, okay, well, what's the feedback we're getting on what we've mentioned in the NPRM? So I don't recall there being any sort of specificities in terms of what sort of training requirements they have, or what sort of requirements that person has to have before even taking that role as a Section 1557 coordinator. But I think that's an excellent question. But these are all great things to bring up when you submit a comment, like asking these questions, even if they're just rhetorical questions, because then there's something that they need to answer in the final rule when it finally gets issued.
Yeah, it makes a lot of sense because, you know, for an interpreter, when you have, well, the interpreter, these are their responsibilities, but we don't know how do we qualify that interpreter. And in this rule, they qualify, well, the interpreter is supposed to know 2 languages, ethics, and so they could do the same with the coordinator role. Is that what you're mentioning, Jody? I think that's a great idea. And something else that I wanted to mention, something that Robert brought up when he says that he tries to educate consumers, persons with LEP about their rights, and they feel scared to file a complaint. I think since they're already considering training here, I think I believe a lot in education, and I think also end users should be educated, because I think only sending a notice of availability is not really helping. It's just a piece of paper. It's not proactively teaching them about their rights. So if there existed such provision, then it wouldn't depend, you know, compliance wouldn't totally depend on the cover entity, but also on the end users really knowing their rights and enforcing their rights with the mechanisms that are available to them that they may not know because there is no education to the public to them. So it made me think about that with these ones. And
could that be done like through community groups and stuff? Because I think that's such an important point. But where would those forums happen? I guess culturally appropriate places. That would be so cool.
I've done something similar to that before. There's actually a local community center here. It's predominantly Spanish speakers go to this community center for a lot of different services, for citizenship classes, for ESL, for English classes, for even learning how to read and write in Spanish. Because unfortunately, a lot of folks are unable to read or write. And I actually contacted them about doing classes, a know your rights training, basically, but about language access in healthcare. But that was before COVID, and then COVID happened, and a lot of stuff got, you know, knocked out of whack. So I think those things, I agree that those things need to happen more, because that's going to make a big difference. And I got a lot of really great questions and feedback from the community. And that's another big thing for me too, is, well, what do the limited English proficient communities, how do they feel about this? How can they submit feedback? How can the deaf and hard of hearing community submit feedback? How can other people who are affected by these pieces of legislation who might not have access to this notice of proposed rulemaking, how are they able to submit their feedback? And unfortunately, it seems like a lot of it falls on us as the people who kind of serve as liaisons between these covered entities and these marginalized groups that utilize our services. It's tough.
Yeah, but I think that would be a great one for a comment, because I'm sure that there are already like educational programs that are, I'm not really sure, but maybe some of them are already funded by the federal government, because I know the program, the WIC, Women, Infant and Children, is from the federal government, and they do all sorts of like teaching moms how to use their breast pumps, and a lot of education happening in other areas. So I don't see why it wouldn't happen in language access as well. So I'm just so glad that everybody's on the same page. But I guess to move on, I suppose, I also like the non-discrimination in telehealth provision. Something that really caught my attention of this rule was like, oh my God, they're talking about telehealth. The oftentimes I feel like ignored pro issue. And they actually have a guidance document for these provisions. And I'm going to share the link at the end with some other links. And we also have a slide that specifies how this provision is to be enforced, right, Kelly?
Yeah, I believe it's right after this one, if I'm not mistaken.
Okay.
There it is.
Okay. So yeah, I think this one is really relevant for us, because after all, this group is called the Remote Interpreters of the Americas group. And so there is a lot of focus on remote and interpretation and telehealth. So I still, I like how at a first attempt, I think it's fine, but there are lots of things that could be specified and elaborated on, because I feel like there are lots of things that happen in session that I noticed that do create a lot of language access issues, but I'm still thinking, how do I make this applicable to this language, to this law, this regulation? And that's why I mentioned back what Roberto and Judith and Vidalita, not Judith, Jessie, I'm sorry, Vidalita were mentioning about the iPads. Or what's the other group? Well, about not having an, what about, there is no provision about having enough equipment to interpret. So that, I think that's a very good starting point just from this conversation. So I don't know, what else do you think, Kelly?
I think for me, this is actually something that, of course, came to the forefront of my mind during the COVID-19 pandemic. COVID-19 pandemic. I think all these numbers are kind of skewing my thinking right now. I was doing in-person interpretation in predominantly developmental behavioral pediatric clinics, and they were having real issues with telehealth, real accessibility issues. What about internet access? What about rural areas that might not have access to high-speed internet? How are you supposed to create equal access to these types of services if, you know, we have socioeconomic issues coming into play where maybe we have folks who don't have internet access, or there's a technological literacy issue. And a lot of times these telehealth platforms wouldn't even be available. The user interface would not be available in a language that the person would be able to actually interact with it. And so a lot of times I, as an in-person interpreter, would show up to a healthcare facility to interpret for telehealth with the provider right there with me, and getting on the phone with the patient to try and help them to access their computer so they could actually connect to the appointment. And they were sounding out the English on the screen. But the thing is that this telehealth platform, it's not the clinic's telehealth platform, it's a third-party service. So I think this is going to go a long way in getting those telehealth platforms to be compliant with this, because it's going to hold them responsible. And then we're going to, I think it is, like Nanji said, a good first step. But I think a lot of the logistical specifics of this kind of might come out as I think we're going to have another final rule or a revision or something coming along, because this is one of those things, you can't just roll this out and then that's it, one and done. It has to be kind of tweaked. I think this is going to get tweaked as time goes on.
Yeah, and I think like us as a group, as the Remote Interpreters of the Americas group, it's really important to, keep an eye on this provision and see how we can provide input and keep thinking about it, because as it is, it's really basic. It's really just a couple of paragraphs compared to all the other provisions. So it's an attempt, but there is a lot of gaps to fill in. And I think as a group, we can work on that together, just like we're doing now. So that's the good news. So do we go to the next slide?
I think the next slides are quotes, actually. If we wanted to, I'm not sure what you wanted to touch on next, or if we wanted to give folks an opportunity to kind of weigh in on their thoughts about the changes to Section 1557, the Notice of Proposed Rulemaking.
Yes, so I think they have been able to participate throughout the meeting. So that's great. And they're also chatting, sending comments in the chat. So before we we want to close the meeting, and we want to give you some information that I think is going to encourage you to really comment, because it's really important and it's really considered. And we're going to specify that from their own quotes. So let's go to the next one. Okay.
Yeah. So this is that quote that I was mentioning about the reasonableness of providing language services and how that reasonableness is shifting with the availability of telephonic interpretation, with the availability of remote interpretation. And actually, Nanji, if you wouldn't mind skipping, because I know this quote is kind of weirdly phrased. Like I was trying to explain it to Nanji and I sounded like I couldn't even speak English. So I made a little drawing of what this quote really means about how the reasonableness of providing language services is shifting. So we have here on the left-hand side, before telehealth, Okay, so the amount of language assistance being provided is indicated by this little purple little filled bar, like a little progress bar. And we have the little red flag, and the little red flag says, well, before telehealth, there weren't a lot of telehealth services available to us. So if we didn't have an interpreter available, and we tried to call to get an interpreter, we might not get one on the line. So that means, you know, there's this little flag here that's going to set the goalpost for what's a reasonable amount of language assistance to be provided under the law. How hard do we have to try to get an interpreter for this person, given the resources that we have? But now here on the right-hand side, we see here that after telehealth, with this increased availability, especially after COVID-19, this telehealth boom, Kelly knows this because when she wasn't able to interpret for a couple of months at the beginning of the pandemic, she was writing articles for a marketing agency, and all I was writing about was telehealth. So when we have more telehealth available, when we have more telephonic interpretation services available, well, this changes the game a little bit. It moves the goalpost a little bit. Well, we have more availability, which means we have more resources to provide to people. So now a reasonable amount of language services to provide folks shifts a little bit further along the lines. So what might have been a reasonable amount of language assistance to provide before telephonic interpretation services, before the advent of telehealth, now that might not be enough. So we might be seeing some shifts in the amount of services that facilities and covered entities are providing, because this is what the Department of Health and Human Services is saying, is that it's more reasonable now than ever, now more than ever, for us to provide these services to folks. There's actually a second quote there, but I think we may have already gone over this. Oh, this is actually really important. This was one of my major takeaways from this. So it says, and I quote, this is from page 47,854. It wasn't 47,000 pages. This is from the Federal Register. So it starts at like 47,000 something, ends at 47,000 something. But it says, and I quote, after considering concerns raised through litigation, stakeholder feedback, and language access complaints OCR continues to receive, we have determined that the 2020 rules approach in eliminating these provisions in their entirety is unnecessary and counterproductive. This is referring to the tagline requirements that were removed in the 2020, well, not removed, but changed in the 2020 final rule. So I wanted to really highlight this quote because I hear from a lot of folks when I tell them to file language access complaints, to file complaints, to hold people accountable. They're like, well, what's the point? I submit a complaint and then what? They're not even listening to me. What's the point? This here shows me, at least they're saying that they're taking language access complaints, they're getting them, they're receiving them, they're doing something with them, they're taking them into account. They're saying stakeholder feedback, the feedback they get from people, they have to legally read our comments. And then we also have a lot of pending litigation, especially when it comes to gender identity, when it comes to Section 1557 and the proposed revisions that are still kind of occurring right now. So there's a lot of stuff going on, and you submitting comments actually does matter. They are actually going to take them into account. And they're saying it right here. Nanji.
I also wanted to add that in I don't remember exactly in which section it was, but they do take comments into account, so much so that you can use they can use the comments that you submit to bring them to court if it's necessary. So these are archived comments that can be used later to make other points or cases or arguments in favor or against something. So it's all recorded there. And the same happens with the provision about the retention of records. Whenever you file a complaint to any entity, it stays there. And when they have to review that cover entity's grievance process, if they notice that there are lots of patterns of negligence in these complaints, they can also use that to evaluate that entity. So I do think, even like you mentioned, Kelly, people think commenting, reporting, it doesn't matter. Well, it does matter. It may not change things right now, but it creates a history of the things that are happening. So I think it's really important to send them, even if it doesn't resolve the issue immediately. It's better than not sending them. Jody?
So you may have covered this before. I'm sorry, I'm getting tired. But are the complaints accessible in multiple languages? Or, because I know that some people have talked about, and when I worked at NYU, they would tell one of the limited English proficient patients to put in a complaint, but then they didn't want to have the hospital interpreter be the interpreter to work with them because they felt. So how does, again, I'm looking at the logistics. This is on paper. This is all, how does that actually happen?
I can handle this one, Nanji, if you'd like. Handle, that sounds so rude. I'm sorry. It's also getting late for me too. I'm a little tired. So the grievance procedures do have to be accessible. That was stated. Now, as a result, it's expected that supposedly someone can file a complaint if they have limited English proficiency. I will say that through the Office of Civil Rights, you can submit a complaint in multiple different languages. Now, I know with the Joint Commission, you can only submit, but the Joint Commission has nothing to do with the Department of Health and Human Services. That is another important avenue to file complaints. I know you can only do that in English. I know that for a fact. So now then you get into the logistics, of course. What if you get a complaint if you are a covered entity and you're a small clinic and you get complaints in 4 different languages? How are you going to process those complaints? Are there a set of standards for how those complaints need to be translated or what have you? We don't know. And that would be an excellent thing, I think, as well, to bring up in a comment. There's no end to the things that we can bring up in these comments. And the nice thing is, I will say logistically, in terms of submitting a comment, I submitted my comment the very first day. I'm still not seeing my comment reflected, so I might submit another one just to be safe. But you can submit a comment, there's a text box, and then you have the option of adding additional files. So what they recommend is actually, you can write the main points of your comment, like maybe a bulleted list of what your comment's going to be in the comment box, but then attach the full version as like a Word document or a PDF probably would be the most accessible, and supporting documents and other things, sources, what have you, to your comment. That's something else that I think I'm going to do when I try and resubmit my comment, because it doesn't look like my comment went through. So.
Okay. Thank you, Joe. That's such a great question. So let's see, what other slides do we have? And
I don't think we have any more. That's it.
Oh, we covered everything. That's
We
so
covered
cool.
everything.
Yay. Okay. So I want to send you a document that you can use like as a go-to document where relevant documentation is going to be linked. So here is the actual proposed rule, the actual document. Here's a interesting document that explains the difference between laws and regulations, and why regulation is so important, and allows us to participate much more in the process of creating regulations. Here's another document explaining why public comments matter. As we have explained here, they really have a legal obligation to consider them. And there is also the document on guidance for non-discrimination in telehealth that explains a little bit more about the telehealth provision. And there is also the 4-factor analysis chart that I think a lot of people just hate this. And now I understand now why they hate it so much. And I'm going to add, I'm going to add the exact link where you can file your comment, because I know this link is all over the place, in all like within a paragraph and a section. So I just wanted you to have it right here so you can directly go to the comment submission form. And I have to add that link. You probably have that, Kelly, right?
Yes, I actually wanted to let you know there were 2 additional things I'd like to add to this document, because we've been working really hard on this, like day and night, like constantly working on this. So we might not have all the links in the document right now.
And are you sending us this I'm not tech savvy enough to figure out how to get it from here to
We
here.
have your email address. And so
Yes.
typically, Nanji, you like to send everything out to everyone after the meeting, to all the email addresses that registered, right?
Yes,
Great.
I'm going to send that. Everyone who registered on Zoom, I'm going to send that, and everyone who is on our newsletter at remoteinterpreters.org. You have to follow our page. This is our page, you guys. We have a page, website, and so you go here and you go to subscribe, and you can fill out this form. Anything like how would you like to collaborate and everything, and this is going to subscribe you to our newsletter where I will send everything. Okay.
But there are 2 additional resources I would like to add. So the first resource, I can't think of the second one now all of a sudden. Oh my goodness gracious. Oh, no, 2 resources. Okay. So CCHI is going to have Mara Yodelman again this Thursday, because she presented, it seems like she did a private presentation for Language Line. And that wasn't publicly available, but now there's going to be one through CCHI, and it actually does have continuing education units available to it. You just have to be there the whole time on your computer and not on your phone, which stinks when it's 2:00 p.m. Eastern time and it's in the middle of my workday, but I'll try. So she's going to be a really great person, a really great resource to know more about the specifics, because obviously we are not, we're interpreters, we're not lawyers. And she does, of course, have a background in law. So of
Do you
course,
know what time that is, Kelly?
it's at 2 p.m. Eastern time on Thursday, I believe. But it's through CCHI. You can register on CCHI's page. I think it was on their Facebook page last I checked. So that's one of them. Obviously, you know, we're just a starting point of information. We're not your end all be all point of information about this proposed change. Another thing is, again, it's from NHELP, which is the National Health Law Program, which Mara Yodelman belongs to. They actually have their page where you can submit your comment through them about the notice of proposed rulemaking. But I like to submit it directly, but I really like the page that they have, because that page gives you like a list of things to mention. You know, it's specific to language access. So for limited English proficiency, like what types of experiences they want to hear about. So it's kind of like their guidelines, their like bullet list of things they think you should tell them about. And I trust them. I really like NHELP as an organization. They're a very reliable source of information when it comes to these things. So I will make sure to send that to you, Nanji.
Yes, so we are going to be updating this document, and I believe the deadline for submission of comments is until September 3rd.
It's October 3rd at 11:59
October
p.m.
3rd. Okay. I remember where we're like, oh my God, we need to do this like as soon as
Gracia,
possible.
stop laughing at me. Gracio's laughing at me.
So October 3rd at what time?
October 3rd at 11:59 p.m. Eastern. I think it's Eastern time. It would make sense for it to be Eastern time because Washington, D.C.
Okay, so, you know, if you have any other resources, anyone else here, we are happy to put them here and share it on social media. Again, we are a baby, you know, group. And in the future, I hope we can really grow the organization. And these resources are going to be, everything that we do, I want it to be saved and tracked so other people can access it in the future. So this recording is going to be available in the in YouTube, and also if you go to our remoteinterpreters.org, you will find all of our social media groups, etc. And also one last thing that I wanted to mention, I just forgot because I just got so excited, but it was really nice being here.
This was Kelly's first RIA meeting, and it was great.
Yeah, this is actually the second RIA meeting ever. The first one was about remote interpreting challenges. We talked about all of the problems of remote interpreting and drafting a document to kind of materialize all that. And then we're going to work on solutions for remote interpretation. So it's really focused on how can we improve remote interpretation, because it's really complicated. Technology is complicated, and we need really a specific. But if you have anything else you would like to add, I think I'm going to end the recording here.